Okay, and we're back with State of the Nation. Our next guest, Dr. Mark Mostert, is a senior researcher at Able Americans, the National Center's project supporting Americans living with intellectual, developmental, and physical disabilities. And he's got an article out called People with Disabilities Thrive When Free of Stifling Bureaucracy. Now, Dr. Mostert, first of all, welcome to State of the Nation. I think that statement is probably true of all people, but it's certainly even more so true of folks living with disabilities. Why don't you go over some of this stifling bureaucracy and regulations that's crushing us?
Yeah, thanks for having me on. This is very important. You know, a lot gets said in the world about people with disabilities and how we should care for them, make them more visible, equity, and all that kind of fun stuff. But when you actually look at the behemoth that is disability-related activism and services, you find, ironically, that many of these large bureaucracies and organizations actually marginalize the very people that they are meant to help. And the piece I wrote was about the International Day of Disability, which is on December 3rd every year, that was instituted by the UN in 1992. And the idea of the day is to be more aware of people with disabilities, to be more inclusive, so on and so forth. So in and of itself, a fairly nice little thing. But disabilities at the international level is pretty much the purview of the United Nations and UNESCO, those World Health Organization, those kind of groups who have these vast bureaucracies that they set in place ostensibly to help people, and I think in many ways with good intentions, but it doesn't work out that way. So in 2006, the UN came up with a treaty, a formal treaty, the Convention on the Rights of People with Disabilities. And the treaty or the convention basically laid out the roadmap of what should happen with people with disabilities going forward. And it's a great list. There's things like end poverty, no more hunger, safety and security. I mean, things that when you read, you say, gee, that's great. I can agree with all of that. So what they did with the convention was to say to country governments, you need to sign on to this because it's going to make you look diplomatically very, very good. It's going to show that you're forward-looking about disability issues, so on and so forth. So countries fell over themselves to sign on to this treaty, and only after the fact, unfortunately, decided and understood that they had to meet certain metrics to these goals in the years going forward. 17 years since the convention was brought into being, panic is happening at the UN in New York because many of these countries, particularly in the developing world, are not able to meet any of these goals at all. It's simply not there. So you have a massive bureaucracy with wonderful things to say, and it's all just dissipated in the pipe dream of good hope and, you know, hanging on to the future without much of a plan on the ground. The bureaucracies take the money, they have incredible layers of bureaucracy, and then the money doesn't go where it's needed, and that is to people with disabilities who really could do with that kind of support.
Yeah, and then to boot, on top of that, you've got big pharma, you've got a brand new, shiny pandemic industrial complex that have appeared, well, they've been there lurking all along, but now they're here, you know, with full force of the mass media cartel to tell you how they're going to fix the problem. And many of these problems come from that systemic system that you're talking about here, this bureaucracy, because it's pumping all these drugs into people. It's not addressing root causes. It's not looking at pure health. It's not looking at holistic systems, diet. I could go on and on. Toxicity levels from the environment. So, I mean, this has got to be, how does that play a factor into the fight in your advocacy?
Well, yeah, at Able Americans, in the National Center for Public Policy Analysis, this is a brand new program, by the way, we are looking at saying, specifically at government in the U.S., does the U.S. government, particularly through Health and Human Services, provide the best possible bang for the buck to people with disabilities? Now, as we all know, the answer is no. We understand that. But getting to those policies and critiquing them is what we want to do. Say, look, you've got policy A. That's meant to help people with disabilities. But just like the UN, it actually on the ground does not help people with disabilities. And you're right. When you get other corporations involved, so you have HSS, then you have big pharma and big whatever you want to talk about. It all kind of blobs together, to use a very clinical term. And you can never see a way out of the morass. I have horror stories of people with disabilities who've tried to access government services resources that are incredibly badly needed. And you know what? They simply can't get through the bureaucracy. They call 20 different people, they get 20 different answers, and they never get the help. That's what we're aiming to do.
You know, Dr. Mostert, I remember when the big push for Obamacare was going through, and all I kept saying on my radio program back in the day was, be careful what you wish for, because big government is not the panacea that you think it is. You mentioned in the lead-in that the UN came up with this and it sounded good and people signed on because it was a checking the virtue box. But what ends up happening is you get more and more paper pushers, more bureaucracy, and less help for the folks that need it. And I think the VA was kind of a canary in the coal mine for what public health looks like. And if it were the canary in the coal mine, it's dead, and it hadn't done a damn thing for the veterans. And I think that's, to your point, that's the bureaucracy talking, isn't it?
Yeah, that's exactly right. And so when you look at again, this bureaucracy of the UN and people with disabilities, and certainly the VA with many patients with disabilities, what you find is they give money to the countries and say, here, the money comes from the International Monetary Fund, the World Bank, corporations. They fund this massive network of non-governmental organizations, NGOs in a country, right? All these NGOs have their own personal agendas, their own political agendas. Then, and certainly I can speak about Africa because I'm from South Africa. Then you run into corruption on the ground. Then you run into violence, famine, war, instability, all kinds of horrible things that preclude the help getting to people with disabilities. And I in the piece I said, I guarantee you, I've spent a lot of time at the UN, unfortunately. I'll guarantee you we're going to have emergency meetings, proclamations, side events at major conventions, and on about hand-wringing about how do we meet these goals. The truth is, a major bureaucracy can't do that. What you need to do is from the grassroots up. And you have to start with things like getting rid of corruption, getting rid of famine, war, instability in society. Then maybe we've got a chance. Other than that, I'm not very positive at all.
Yeah, and I don't know that the UN's roadmap is the one that's going to actually get us there. This feels like the kind of thing that we, the people, citizens of the United States, citizens of the globe, should be able to do for one another, for each other, for ourselves, and institute systems that will continue that as we all go through different phases of life here and deal with different disabilities, health matters and such. Now, Dr. Mark Mostert is our guest. Dr. Mark, please hold the line. We have a headline inbound here with today's news talk. We'll pick up right here on the other side. This is State of the Nation on TNT Radio.